morning, everyone. Come on up here and join us, guys. We have enough space. I'm joined today by a cavalcade of folks from our team. Commissioner of Health Judy Persicelli to my right, State Infectious Disease Epidemiology Program Coordinator Dr. Lisa McHugh. We'll hear from her. Is Chris with us? Chris Newworth? Chris is with us. What's your actual title?
Assistant Commissioner.
Assistant Commissioner Chris Newworth. Assistant Commissioner for Public Health Infrastructure, Laboratories, and Emergency Preparedness, Chris Newworth. Education Commissioner Dr. Lamont Repillette, State Superintendent, and our host today, Colonel Pat Callahan. Thank you, Pat. Director of Homeland Security Preparedness, Jared Maples, and Chief of Security at the Port Authority of New York, John Billich. So together, we would like to reassure residents of our efforts to protect them, our state, given the growing and rightful concern regarding the coronavirus and the COVID-19 illness it causes. First, to be clear, we currently have no confirmed cases of coronavirus or COVID-19 in New Jersey. Based on Centers for Disease Control standards, with pneumonia requiring hospitalization, no other alternate explanatory diagnosis, the flu will undergo precautionary testing for the virus. Just been one person will be tested, and Commissioner Persicelli instance. But to now, the individual tested under the standard has been positive for coronavirus. To that is relief, but we're not allowing ourselves to sit back. Way we're committed to keeping state government an active and engaged position on properly and effectively future individuals who meet the CDC guidelines for coronavirus testing. This is a multi-level and whole of government effort. It includes our hospitals, our schools, and the personnel at our ports and airports. And others up here with me will speak to this. And our preparedness also includes our residents. We remain in close contact with our federal partners at the CDC and other agencies. In fact, several of us were in the White House on Friday. I spoke to Vice President Pence on Friday evening. I just participated, and many of us were with me, in a video conference with the Vice President, Federal Health and Human Services Secretary Alex Azar, White House staff, and governors from across the nation to discuss our national preparedness. And that's the reason why we're a little bit late. That call went on a little bit longer than we had expected. I was proud, as I was on Friday, to be able to speak with the Vice President and his team just now, and to once again engage directly in a dialogue to ensure that our needs as states remain front of mind. As I mentioned, we had a very constructive, open engagements toward the end of the week, both in the White House on Friday and on the phone Friday night, and the Vice President complimented our state's aggressive and proactive stance. Tomorrow, I will convene a series of calls with stakeholders across our state to update them on our preparedness efforts and to ensure we are all working from the same playbook. One call will be with school superintendents and the leaders of our colleges and universities. The second will be with representatives of our business community. And the third will be with local county officials. Of course, we are in the midst, and it bears repeating, cold and flu season, and residents with respiratory ailments are more likely to be suffering from a cold or flu and not coronavirus. As of this moment, as I mentioned earlier, the overall risk of coronavirus is low. The Department of Health is maintaining the coronavirus information page on its website, which can be found by visiting NJ.gov/health. That's NJ.gov/health. And the state's toll-free public hotline for any questions that residents may have also remains in service, and that number is 1-800-222-1222, 1-800-222-1222. 1222. We ask that any residents with questions or concerns make those, either the website or the phone number, their first stops. We are working closely with officials at the Port Authority, which operates Newark Liberty International Airport, to ensure that any passengers who may have been exposed to coronavirus are properly screened so they do not pose a threat to the public at large. Newark Liberty remains one of the nation's 11 airports through which all flights originating in China will land, and they are taking responsibility to securing public health with the utmost seriousness. As you'll likely hear from John in a few moments, direct flights have stopped. I think when we started this, there were 29 a day. There are now none. The folks still screening for passengers who have China in their travels and are coming in through a different port. We also recognize that the threat of the coronavirus is not just to public health, but to the economy as well. The global data is showing us this in very real terms. This is another reason why we will remain fiscally responsible to ensure that New Jersey's financial footing remains on sound practices, so we have resources available through both surplus and the rainy day fund to protect against any emergency. Residents, the surest way you can protect yourself is to wash your hands frequently with soap. Cover your cough, sneeze, out with your hands, and to avoid touching your eyes, nose, or mouth. If you feel under the weather, take a day off from work or school and check your doctor or health care provider. It's most cold coronavirus. Only those who meet the CDC's criteria will have specimens tested at state health and environmental laboratories, which received federal approval last week to end coronavirus. All of us up here keep safeguarding the public safety, one of our take health and wellness for 9 million fellow families. This for weeks here, staying vigilant. I phrase that I let no time to panic, but time to be prepared. For weeks, readiness and a of government approach will continue that way. Like Commissioner Judy Person for the podium and give us.
News expanded across the globe in the United States. 87,000 cases. So far, New Jersey, 8 people have tested negative for novel coronavirus. Under investigation delivered a later today, and will be not hospitalized and virus is for New Jersey residents. We are closely with the CDC and public at the response meeting in January 24th, we created a crisis management that has daily a coronavirus answer from to executive a coronavirus task force to coordinate all state efforts to prepare for and respond to the public health hazard posed by this virus. This is a whole of government approach. I also want to take this time to remind everyone that the flu continues to be a public health concern right now in our state. There is currently high flu activity statewide, and there have been more than 5,000 cases of flu and 2 flu-related child deaths. The same precautions that you take for the flu are exactly what you should be doing to protect yourself from the coronavirus. Use respiratory etiquette, covering coughs and sneezes with a tissue or a sleeve. Wash your hands often during the day with soap and water for 20 seconds. And stay at home if you are sick. If you have symptoms, you need to visit a doctor's office or an urgent care and emergency room, and you are able, call first and tell them why you are coming. I encourage the public to visit our website, NJ.gov/health, for information on novel coronavirus. The website has fact sheets, answers to frequently asked questions, travel advisories, and guidance for businesses, universities, schools, and healthcare providers. New Jersey continues to work very closely with the CDC and local health partners to monitor this situation. We understand that the public is concerned, but I want to assure you that we are taking all steps available to protect the residents of New Jersey. As this situation evolves, things will change quickly, and we will continue to keep you informed. Thank you.
Thank you. Well said. Thank you, Judy. We're going to keep things moving along here. Again, apologize for starting later. Please help me welcome Dr. Lisa McHugh, who's the Infectious Disease Epidemiology Program Coordinator. Doc, come on down.
Thank you, Governor. So first, I just want to give a brief update of where we stand to date. So in addition to several new cases that have been reported in states predominantly on the West Coast, including California, Oregon, and Washington State, there have been many recent additions this weekend. 2 individuals reporting confirmed cases, including New York City, Florida, and Rhode Island. So some of these cases have had direct travel to areas with known COVID transmission, while others appear to potentially have no linkages to those areas, indicating the likely potential of community transmission of the virus in these particular areas. So another common question that we get is, do we know more about the clinical illness? I'm sure you've heard many of us say that there's a lot that's still unknown. We are still learning about this virus, but as new cases are being reported to us, we are garnering new information. Overall, the illness does appear to have a very wide range of severity, from cases with very mild illness, similar to the common cold, which does appear to be the majority of cases that are occurring, to those with more severe illness requiring hospitalization. Those with the most severe presentations have been in adults predominantly with underlying health conditions. Worldwide, thankfully, there have been very few cases reported in children, and of those reported, of those illnesses in children, they tend to have been mild. Many are asking what New Jersey is doing to identify COVID in the state, and we are closely following guidance published by the Centers for Disease Control and Prevention in the identification and testing of potential cases. Based on the growing number of cases that have been reported, late last week, CDC modified the criteria has already been discussed, which are evaluating these people for testing. Around the same time, we also learned that the State Public Health Laboratory had the ability to begin testing for COVID. As I mentioned, like all other states, we are using this new criteria provided by CDC to evaluate individuals. It's important to remember that these are screening criteria, useful in identifying persons that require additional evaluation. These are not diagnostic criteria for COVID-19. Patients meeting this surveillance criteria might have many other conditions, including influenza, other respiratory virus, and bacterial infections. We're encouraging healthcare providers to conduct a thorough clinical evaluation early in the course of their hospitalization to help us rule out some of these more common infections and other causes of lower respiratory tract disease. The new CDC criteria that we're now using is very broad, and it doesn't include not only individuals who have a travel history to areas with COVID transmission, as identified by CDC as those countries with a level 2 or higher travel advisory, but also includes individuals hospitalized for pneumonia in which a cause is not readily identifiable. This broad approach means that we'll have more individuals eligible for testing, but it also does not mean that every one of these individuals will be tested. Commonly, community-acquired pneumonia cases requiring hospitalization are fairly common and occur very frequently, and often there is not a known cause for their illnesses. The New Jersey Department of Health Communicable Disease Service staff is using information that we know about COVID, both its epidemiologic and clinical criteria, to determine who best fits this criteria for testing, especially in that group that does not have identified travel risk factors. As been previously mentioned, we've had 3 individuals who've been approved for testing over the weekend and have all been found to be negative, and our team continues to work with healthcare providers on evaluating and approving individuals that have been reported to us. With no confirmed cases in New Jersey, the risk remains low to the general population, but is slightly higher for those individuals who may have traveled to some of these areas where COVID transmission is occurring. And even though there are no cases and the number of detections remains small, as we begin to do this additional testing, it does remain likely that we may identify cases in the near future. And I know that individuals are concerned about COVID, but I want to assure you that all individuals, all levels of state and local government, as well as the healthcare provider community in our state, have been preparing for COVID-19. And should we identify a case or several cases, we are ready to respond and to begin to take necessary public health actions. I know all of this may sound like some bad news, but the good news is that we don't have any cases in New Jersey, and there are actions and preparations that you can take to begin to keep you, your families, and your communities safe. Schools and businesses should be preparing for ill students and staff. We suggest that you review guidance materials that are on the CDC and NJDOH website on how you can best prepare your communities. As the Commissioner had mentioned, individuals are recommended to keep prevention for all illnesses, frequent hand washing, avoid touching your face, covering coughs and sneezes and issue or your elbow. And stay home from school or work if you're sick. If you are sick, avoid crowded public places. If you do become sick, monitor your symptoms at home by taking your temperature and contact your healthcare provider for medical advice. They can help you determine if it's necessary for you to be evaluated in a healthcare setting and give you steps that you might take to help protect others in that healthcare setting should you need to be evaluated. My colleague in a few will provide some additional details and steps on what additional steps you might do to prepare. And I just want to illustrate one additional thing in which we are not recommending that the average individual do, and that is stock up on masks. CDC is not recommending the routine use of face masks or respirators outside the workplace setting, meaning in the community. These are reserved for our healthcare providers. Most often, the spread of respiratory viruses from person to person happens among close contacts, meaning about within 6 feet, and with prolonged contact. CDC recommends that everyday preventive measures that I've just outlined is what you should be following. You should only be wearing a mask if a healthcare professional recommends it. And this may happen when an individual is sick and is being evaluated in the healthcare setting. And again, this is to help protect others from getting infected from that individual that is ill. Thank you.
Thank you, Lisa. Lisa mentioned testing, as did Judy, as did I, and I glossed over a point before Chris comes up, and I mentioned passingly in my remarks that we had gotten the approval to test in New Jersey as late last week. That's a big deal for us. So I think, Judy, our turnaround, or Lisa or Chris, our turnaround now is something that looks like hours, as opposed to having to send the swath down to Atlanta. If we get a positive test, we will still send it down to Atlanta to triple check. But negative tests, we're able to get our arm around much more quickly. So with that, please help me welcome Assistant Commissioner, Department of Health, Chris Neuwirth. Chris.
So good afternoon. The Department of Health continues to work closely with federal, state, and local partners to ensure all COVID-19 preparedness and response activities are happening here in New Jersey are aligned, organized, and fully coordinated. Emergency management and state health officials, including members of the Governor's Task Force and the Department's crisis management team, remain in constant contact with our colleagues at the U.S. Department of Health and Human Services and the CDC to identify, develop, and share planning resources for healthcare facilities, K-12 schools, institutions of higher education, and of course, individuals and families. There are a number of preparedness activities that we encourage healthcare facilities, including hospitals and long-term care centers, to implement immediately to mitigate against COVID-19 transmission and to conserve limited medical resources. First, the CDC permits the limited reuse of N95 respirators for healthcare workers while treating cohorted patients, all with the same respiratory illness. A healthcare provider may continue to wear their own N95 mask while treating multiple patients with the same illness. Second, facilities should consider using alternative respiratory protection devices, such as air purifying respirators and powered air purifying respirators. These devices can provide the same or higher levels of protection as an N95 face mask, but are reusable and can be worn by healthcare providers for longer periods of time while treating patients. Third, healthcare facilities should prioritize existing medical supplies, including N95 respirators, for healthcare workers directly caring for individuals with communicable respiratory illnesses. Other healthcare workers not providing direct physical care may be able to complete their activities at safe distances from the patient that would not require them to wear the same level of personal protective equipment. Fourth, healthcare facilities are discouraged from disposing of expired N95 respirators. These expired face masks can be used for education and training purposes so that unexpired respirators are conserved. While these are only a few examples of the proactive measures healthcare facilities can take, we want to reassure the public that we're actively working with healthcare providers to ensure they have the latest technical guidance from the CDC. For our K-12 schools and institutions of higher education, we encourage all administrators to review their business continuity plans, identify opportunities to limit, reduce, or reschedule mass gatherings, and identify opportunities for delivering academic materials remotely using various technological tools and resources. Individuals and families are reminded to plan for child care arrangements if schools or daycares are temporarily closed. In addition, individuals should prepare their homes for telecommuting if your employer allows you to work from home. More so, we encourage individuals and families to remain connected with the latest information from the Department of Health by visiting NJ.gov/health or calling 1-800-222-1222 if you have any questions. As the situation continues to evolve, the Department of Health will remain in close contact with our federal, state, and local partners to ensure all preparedness and response activities are coordinated and that the latest CDC guidance is distributed in a timely and effective manner. Thank you.
Thanks. Thank you, Chris, and I promise never again to forget your title. So Chris mentioned schools, and obviously that's a question that comes up a lot from parents and kids themselves, so please help me welcome the Commissioner of the Department of Education, Dr. Lamont Repollet.
Governor, Commissioner Berticelli, thank you for the work you have done and continue to do marshaling every resource of state government to keep the public safe and informed of the latest developments regarding coronavirus. I would like to take this opportunity to remind educators, parents, and the public at large of 5 things. Communication is vital. Our county offices of education are our boots on the ground. As questions emerge regarding appropriate coronavirus response and preparedness protocols for your district, please direct those questions to your county office of education. All county offices are directly in touch with me here in Trenton. The more we know about questions and circumstances faced by different parts of the state, the better information we have to share with our colleagues at the Department of Health, the better we can collaborate to disseminate factual, appropriate resources to our community. Number 2, specific guidance from the Department of Health is available. We provided guidance to all of our districts via broadcast system on February the 3rd. We encourage districts to continually monitor the Department of Health and the CDC's web pages. Existing policies and procedures reported on home instruction. I would like to remind districts and the public of a few policies and procedures that should already be in place that might inform of a community's coronavirus planning. Under DOE regulations, districts should have protocols in place for the provisions of home instruction in a home or out-of-school setting, either directly through online services or through contract with another district for students with temporary or chronic health conditions. All districts are required to immediately report any communicable diseases that are identified as reported under Department of Health regulations, whether confirmed or presumed by phone to the health officer of the jurisdiction in which the school is located. Continued collaboration. As Commissioner Berticelli said, our team share a commitment to bring a coronavirus task force resources to bear on the issue of school emergency preparedness. I would like to thank my colleagues at the Department of Health for our close and continuous collaboration on this goal. Combating stigma. Finally, I would like to add to this. The public health professionals on this stage and at the CDC have provided detailed guidance regarding the prevention of coronavirus disease 2019. The CDC also warned us that fear and anxiety can lead to social stigma towards Chinese or Asian Americans. Let us make sure we're better than that, because stigma hurts everyone. Bullying and harassment in our schools hurt everyone. Educators, members of the public, let's all recommit to raising awareness of this information without spreading fear or stigmatization. Thank you, Governor.
Amen on the points on stigmatization. Lamont, thank you. Please help me welcome our host, the Superintendent of the State Police, Colonel Pat Callahan.
Thanks, Gov.
Pleasure.
Good afternoon, everybody. I'll be very brief. I would like to thank the governor, his leadership, and all the partners that you see here today. From an emergency management standpoint, we look at this as we have with all the other challenges that have faced New Jersey and come at it with those pillars of emergency management: preparedness, mitigation, response, and recovery. The whole goal of the preparedness and mitigation part is to not have to get to response and recovery, but we're prepared to do that. Our emergency management staff here at the State Emergency Operations Center, embedded right here at the Rock, has been working since the middle of January with Commissioner Persicelli and all the partners up here, John Billett from the Port Authority, across all levels of government. We're in constant communication with state, county, and local health officials to make sure that the citizens in New Jersey are safe and protected. And that's what we're here for. So again, humbled to be part of the team and appreciate all the efforts that have gone on in the last 6 weeks. And I look forward to making sure that that communication and preparedness and mitigation efforts remain robust for all of us here in New Jersey. Go.
Thank you, sir. Deep appreciation for that and for hosting us and for everything you do. Last but not least, and then we'll take a few questions, the head of security for the Port Authority, New York and New Jersey. Please help me welcome John Billett. Thank you, John.
Thank you, Governor. Good afternoon. We continue to work closely with all our federal, state, and local partners, particularly New Jersey Department of Health and the New Jersey State Police. Screening started on February 3rd. And it's being led by the Customs Border Protection and Federal Center for Disease Control. At that time, when it started back on February 23rd, there were 29 direct flights to mainland China. Today, there are 0. However, there's a daily scrub of travel data that the Customs Border Patrol conducts, and as a result of that, there are, on average, 75 people that are screened daily. Of those, only one has been identified as requiring quarantine, and that happened on February 4th. We haven't seen in Newark and or Kennedy a quarantine condition since February 5th. In instances where there might be the need to quarantine and or take somebody to a hospital, a process has been outlined in which the individual is taken ramp-side, escorted by the PAPD, accompanying the New Jersey Department of Health. This is done to facilitate the quick removal of the patient for necessary attention, and it eliminates unnecessary contact with the general public. We stand up an airport operations center that's stood up 24/7. This is our coordination point in which we communicate with all partners throughout any event or go through the schedule for today, the next day, and the week ahead. As of yesterday, in addition to screening done for individuals, citizens, green card holders, and or flight crews from China, Iran has been added. So the Port Authority is prepared to continue to assist in any way we can and work as partners going forward to protect public health. So I thank all of you, and I thank the Governor. Thank you.
Thank you. Appreciate it. We'll take a couple of questions. Before we do, a couple of quick thoughts. One is I'd like to keep it on topic. If you've got off topic, we'll figure out a way to get back to you, maybe even on the side or at some point. Secondly, we've said, several of us have said this, the amount of folks having been tested so far in New Jersey is low. You just heard it through John's lens, through the Port Authority. Judy talked about that as well. You've heard us say, several of us say again today, that the overall risk right now is low, and that's a fact. I don't want anyone to mistake those statements with any amount of casualness. We're taking this aggressively, seriously, doing everything we can proactively to get out ahead of anything that might come our way. So this is a constant. There's no topic, I think, in government right now that is being more within our teams across our departments that is either a higher priority or that is getting discussed more. So again, relatively low public health risk, because that's a fact at the moment. Assume for 1 second that we're casual in any single way about this. We are taking this very seriously, aggressively, proactively, doing everything we can to try to get out ahead of it. Brian.
Governor, can somebody please enumerate how many people in New Jersey have gone through or are currently in quarantine from whatever source of origin of travel, and the person who was at Bayshore this past weekend that was tested for coronavirus, what kind of symptoms names? Can you share about that person that raised the alarm bells? That person?
I'm not yeah, I think we'll probably do that as a general matter because I don't want to violate any privacy issues. There's no one quarantined at the moment. So there's 0 persons who are quarantined, and there have only been a handful. John mentioned one person who was a traveler, and there were 4 people out of a cruise ship, as I recall, all of whom have left New Jersey.
Just to elaborate, though, we've heard that something like 13 in Ocean County and 9 in Monmouth County.
You're talking about those that
Come on into the
are
microphone.
home on self-quarantine,
Yes.
low risk and medium risk. I don't have those numbers, do we? We'll be able to get that for you. These are individuals that have had some travel or connection with someone who has had travel through particularly mainland China at this point. And they're screened and they're home, but none on high risk
They're
self-quarantine.
asymptomatic, are they?
Yeah, asymptomatic, no high risk. They're all low to medium and primarily low risk.
This is an abundance of caution, I think, is the way.
Can you say anything?
Well, I guess the general, Judy, I'm practicing without a license here. The general symptoms that someone would exhibit would be a fever, respiratory issues, coughing. Those would probably be the
Shortness of
3
breath,
things.
coughing, sniffling, and certainly fever. They're symptomatic.
I think we're not going to speak about a specific
No,
situation. but
low
there's-
risk people, most of them are asymptomatic.
We'll come over here, Brent.
Just
Stay
a
close.
question. You said anyone who is showing signs of the flu, with no other reason where they came from will be tested? And
No.
No.
Someone who has pneumonia, and there is no obvious source for that pneumonia. That's now been added to the persons under investigation characteristics. Is that accurate?
Correct.
People, so there will be, in New Jersey, there will be more tests, and you're expecting some cases to be positive?
It is not unusual, under any circumstances, that there's a number of people in hospitals in New Jersey that have pneumonia where the cause is undetermined. They don't get a culture of a bacterium, or they just don't know. That's a very, I don't want to say common, but it happens a lot.
And so there's one person right now who we are expecting to test today who fit that criteria.
And then, but you said there are likely more cases to be tested in the future, and you're expecting at some point to have a confirmed case of coronavirus in New Jersey?
I would have to say, given what we're seeing in some other states, I would not be surprised if that happened.
Yeah, I don't think we should be shocked if that were, but please.
You were talking about what a game changer it is to be able to test in the state in turnaround time. How widely, though, distributed or available are the kits for individual doctors' offices or urgent cares? How available are they?
You have to be approved by the FDA to do the testing. At this point, the Department of Health lab is the only approved lab in New Jersey. There are other commercial enterprises that are going through quality control to be able to prove to the FDA they should be
As well
certified.
as healthcare providers.
Samples, that's what I meant. I mean, but readily available is for them to take samples and send it to you folks. Is that difficult to do, to take the samples?
Oh, the samples are nasopharyngeal swabs. The sampling,
Just a typical thing.
yeah, it's just a swab.
Give me a sec, please.
Commissioner, can you talk about what would cause a school to have to be closed or a whole district to be closed, and what are some of those protocols that those districts have in place to keep those kids educated at home?
Guidance from the Commissioner of Health, from the Health Department, and from CDC in regards to that, because it's a medical condition. The students are being forced to close as a result of medical condition. In regards to school closure, our school closure, we normally have that process in place and they have protocols. However, this is something different because now the school closure may be of a health concern rather than Superstorm Sandy.
Can you just go through those protocols, how, give an example of the district and how they would continue educating?
Well, they'll continue education, whether it's online platforms, whether it's through a lot of communication. Google Drive is one of the most popular platforms. They have a lot of districts have various platforms that can deliver information or instruction via the internet.
There's also, I think Lamont may have referred to this, we had a long discussion upstairs. There are also sort of some baby steps that you can take that some schools have taken, such as postponing general assemblies would be an example of that, to keep kids in the cohort of the classroom. Please.
So just to clarify, the person whose test we're waiting for to come back
Yes.
And can you tell us a little bit more about this case? What county, male, female?
We won't get into the details. The person has not yet been tested. I want to make sure I've said that is correct, right? They're not yet tested. This is a person who's actually at home, has had a medical issue, and I'll leave out the specifics of the actual case. Please. I'll come back to you.
Lieutenant Governor involved in these briefings in the case that occurs while you're not able to?
Lieutenant Governor, we keep up to speed on everything we do, including this. Please.
Regarding the screening at Newark International Airport, who are these people, 75 per day? Where are they coming from? What countries, and what's the protocol?
I think the genesis is still overwhelmingly China and now Iran, right?
Sure, that's correct. So anybody that has a nexus to China based on travel itineraries or a history of touching China, they have to be a U.S. citizen and or a green card holder or even a flight crew person that emanates out of China. Maybe they flew into Paris and then they come to the U.S. They'll be identified and they'll be screened because they are known to have had a touch with China, mainland China and now Iran.
So we signed, John reminded me of this. This is extraordinary. 4 weeks ago today, there were 29 direct flights into Newark Liberty from somewhere in China. There are now none. That's gone from 29 to 0. Folks are still traveling through Paris or wherever it might be and still coming here.
Can I follow up real quick, Governor? So what do you recommend to people of New Jersey who have travel plans to other countries? I think, well, there aren't a lot going to Iran, so that's an easier one to deal with. One in New York was...
Yeah, I know that, but again, I'm not making light of it, but that's not a big bucket. Use your common sense. We've got a family member who's potentially traveling somewhere in the next few weeks, and we were having this discussion at the dinner table last night. I think you have to use your common sense, including, is it possible that while you're in country X, that they have some sort of a community spread or some sort of a positive test, and you, by completely innocent and completely healthy, unrelated to the test, may be limited in terms of your own activity when you're coming back, in terms of your quarantine requirements, et cetera.
Is that child going to go someplace or not?
I'm not saying he's even a child. I said a family member. Please. I apologize. I tried. No, go. That's all right. We'll get to you all. What could one of you please say? No, I didn't think there was anything new on the call. It was informative. Alex Azar, who we've known over the years, was good. Their communication, I would give them high marks on their availability and communication. The two areas that we're going to need help on, and by the way, they're acknowledging it and we're acknowledging it, and Judy and team are going to follow up on this, I would guess by tomorrow at latest, is whatever medical supplies do we think we need. And before you ask, I don't have an answer for that yet, but just again, to be preventative and prepared. And also how much this is all costing us. They have to their credit, they've got an explicit willingness to reimburse and or figure out where we can get backstopped financially. They want to get an appropriations bill through Congress very quickly. There's some discussion as to what the amount should be. The Speaker was here in New Jersey over the weekend. It feels very bipartisan to me. She was very supportive. I think they're trying right now to figure out what that number ought to look like. But I would give the Vice President and the team that we've been dealing with pretty consistently. George Helmy's in the back has been literally constant, nonstop communication with the White House since, in particular, over the past couple of weeks, in particular since last week. Please, and then we'll come back.
So two questions. First, just to clarify, the woman is a woman who is going to be submitting samples. Is that person self-quarantining at home?
They're at home, right? The person is at home. We're not going to acknowledge any of the details of it, right? Is that they're at home? Yeah.
Second, we saw some people sort of stocking up against quarantine over the weekend. Is this something that you would recommend that you decide?
Bless you. Please, I hope that was into your arm.
Say if you should happen to end up in a 14-day quarantine.
Yeah.
And if so, what would it be?
You heard Lisa say, in particular, there's been a run on masks. I know in New York City, I think even more so than in New Jersey. Yeah, I mean, listen, I think everyone's got to use common sense here. When we say there's a low risk, we mean it. That doesn't mean that that we're, as I said, we're being casual or that folks should be casual. I personally think you ought to use your common sense, and there's at the moment at least no reason to be behaving in some sort of an abnormal behavior. Would you all agree with that? Again, I'm practicing without a license up here. Dustin.
There's a lot of numbers to ask. Can you or the health commissioner clarify how many tests have been done by the state, and what's the capacity of how many tests can be done in a day for the Department of Health lab?
Come on down. So, Judy, how many tests have been done in total?
8, and they're all negative.
8 and all negative.
What's the capacity of the lab?
Well, the capacity right now is determined by the number of kits that we have. So at this point, we probably, at the rate we have right now, we could go a month. But if it increases, we would need more kits.
And Dustin, this would be on the list of, when I mentioned a minute ago with the Trump administration and the vice president asking, what are your needs? It's dollars and medical supplies, and certainly kits are on that list. Please.
If I'm flagged for screening at the Newark airport, what happens to me then during that?
You get to meet John, who's going to come up and answer. Sorry.
So if you're flagged, the CDC sees you. There is a series of questions. There is an evaluation of you. They take their temperature. If there's an affirmative answer to a question and or a temperature check, then there's some sort of tertiary screening, and then a determination is made by CDC.
Actually, I want to make sure, Brian, I'll get to you. I want to get people who haven't asked yet. Michael.
Sure. I was hoping for some clarification on what's the criteria for when something gets described as a suspected case. Some people, newsrooms, members that are in public will hear that and think that's a probable case. Some people will think it's a possible case.
Yeah.
What does that mean?
So let me take a shot at this, and then Lisa's going to give you the medical. So persons under investigation, how do you get on that list is basically what you're asking. I guess symptoms is one reason, right? So your temperature, coughing, respiratory issues, and it's not imminently traceable to some particular event, like your spouse had the same thing and you caught it from them. Secondly would be travel.
Travel with respiratory symptoms. So we're following the
travel on top of that,
yeah.
right?
So we're following the Centers for Disease Control and Prevention. There are persons under investigation. And so really what that means is it's just a cue to healthcare providers on what we're asking them to look for to report to public health, and then we can talk to them and make a decision. So if people have respiratory symptoms, fever and lower respiratory symptoms identified as pneumonia, so people taking an x-ray or getting a CAT scan that identifies something, an issue with their lungs. If they've had travel history, that's one thing. But this other larger bucket that CDC has implemented is kind of not having a known travel history, but having some type of, we don't know why you have pneumonia. There's no described, they haven't run a test and found a bacteria, or they haven't run a test and found a virus, which unfortunately is very common, but this is something that CDC is concerned about because of some of the severe illnesses, and trying to keep it out of our healthcare systems is something that they're pushing for us to proactively test. And so that's part of our new criteria. And that's really the reason for the increase in the testing that we're conducting right now.
And the broadening of that definition will invariably lead to a lot more testing, to the question I think that Dustin asked, invariably. So, for instance, I just want to add to that. So you're not getting the CDC and CBP, Customs and Border Patrol, John, correct me if I'm wrong here, they make the decisions as to which country of origin somebody has to be taken into secondary or tertiary. A person under investigation, that definition is broader. So while you're not stopping, correct me if I'm wrong, people coming off a flight from Milan, if you find someone with respiratory issues, temperature, coughing, and they've been to Milan, that automatically puts them into a different category. Does that make sense? Brian.
Governor, what you're just talking about, and maybe John, maybe he can't answer this, but we have fairly significant clusters now in northern Italy, Milan flights being canceled by the airlines,
Yep.
American and Delta for sure, and large clusters in South Korea as well.
Yep.
Neither of those countries are on this proscribed list, and even in the case of Italy, flights coming in from Rome, you could have had somebody who was up in the Piedmont, Lombard area, whatever.
Yep.
Not staying in quarantine.
Yep.
But what
Thank you for that. I appreciate you throwing that in.
Is there any concern at all
large,
Yeah.
significantly large cluster countries?
I'm just going to say something, and one of which I'm going to say sort of it's above my pay grade. Number one, yes, enough that it's now a criterion on the list of when we should be concerned about testing somebody. It's my guess, I don't think John or I know the answer to this, it's my guess it's only a matter of time until you would think, right? So you've got China and Iran right now. You would think Italy and South Korea, I would guess sooner than later, but it's not our decision. That's a CDC, CBP decision. It does impact us, though, because Newark Liberty, if that were to be the case, would be one of the 11 funneling airports. Is that fair?
It's fair.
Would you support the president declaring a public health emergency in response to coronavirus, or is it too early?
I mean, I don't know. My complete focus is in the 9 million of us who call this great state their home. And I know we're not there. It's a low level of risk. So I don't want to speak for the president. I think the states where it sounds like from the discussion we just had and as we've been having, state of Washington and California are the two states right now where there's a high amount of focus, not just at the state level, but from the federal administration as well, given the two sort of community spread realities. I would say one thing which I don't think we've said a whole lot yet. Lisa talked about the types of people who have been getting hit, and I want to underscore what she said. An adjacent health issue has also been a factor here in the more severe cases and fatalities. I wouldn't say in every case, but that appears to be an element here. So, put differently, if you're in a picture of health, you should still, be preventative, wash your hands, et cetera. And if you were to be infected, you still have to take that very seriously. Let there be no doubt about it. But in many of these cases, the severe cases and indeed fatalities were involved with people who had an adjacent health issue. Charlie, we're going to end with you, I think. Please.
As you know, the president has been making accusations that the Democrats have been hyping this political game. I'm just wondering it's called a hoax. I'm just wondering if, in your interactions with the vice president and his team, that they shared that or tried to downplay that or disabuse that notion while you're on the phone?
Yeah. So, again, we were in the White House for other business, but this became a big chunk of our conversations on Friday. Spoke to the vice president on Friday night. George has been on the phone with senior members of staff all weekend. And then we have the conference call or video call, which we just had. We've seen none of that. And we have committed that this is not partisan. This is not an opportunity to take shots. This is about public health. And that impacts all of us. So in our deliberations, we've seen literally not a shred of evidence of that.
Then sharing that same view?
Not a bit. Not a bit. I would say the vice president's been extremely professional, as has the secretary and the other team members with whom we've dealt. And we've committed, by the way, that on our side we will be the same. We want to get this right. I want to thank this cavalcade of stars up here. Jared, I know your thoughts were with us, and we were channeling you the entire way. So thank you to you and John and Pat and obviously Judy and Lisa and Chris and Lamont. Thank you all very much. Well done. Thank you, Lisa. Chris, sorry.